Serious, doctors of Reddit, what are the red flags that people should look out for in order to avoid an incompetent or bad doctor? Apart from choosing a good doctor, try to be a good patient too. Trusting the doctor plays a major part in the process of getting better. Rather than bad doctors, there are those that have a paternalistic attitude, thus leaving you feeling impotent. Choose a doctor you feel comfortable with. Prices have nothing to do with quality. In fact, most good doctors will not have an absurd fee. I'm a specialist, but I think this applies to both general practitioners and specialists. Disclaimer: as others in the thread have mentioned with their posts, I've known both really good and really bad doctors who would fit these criteria. Incompetent: a doctor who never says I don't know. Medicine is insanely complex, and a good physician should always be using resources, textbooks, journals, doctor, Google, etc. as a refresher and to keep themselves up to date. This generally cannot be done in the exam room. If you show up to your doctor's office with new complaints, don't always expect an answer solution immediately unless your problem is really straightforward. Part of this may be the need for labs imaging, but part is just giving the physician time to digest what you told them and plan what to do about it. Saying I don't know doesn't make them incompetent, but just the reverse. At least they know when they are out of their league or are being careful with your health. If they always know the answer, and especially if they are defensive with any questions, they are probably trying to hide their incompetence. Bad: ordering complex tests for every little problem, especially if they have the machine in their office and can get it done the day you show up. Sure, this sounds convenient, but too often the doctor, or the doctor's group, owns the machine and make a little extra money by getting you to use their equipment. Labs probably excluded. I would emphasize this even more strongly if you are there for a checkup and a bunch of tests are ordered unexpectedly. Personal story: a healthy young adult family member moved cities and made an appointment with a new doctor only to get her birth control refilled. Yet after the physical exam she got a heart ultrasound in the office, among multiple other tests. The ultrasound is not a routine test, probably costs north of $1,000, and came back completely normal. The clinic note only says the normal heart sounds were not well heard, not an indication for that test. Maybe had this person been elderly and never had medical care before I could understand, but this is a young individual with regular medical care. Can I prove any malfeasance? No, but that doctor's behavior does not give me confidence that they had my family member's best interest at heart. If they ask the right questions but don't pay attention to the replies. A lot of lazy doctors just have a script they work through, and so long as your replies don't completely throw them off, they just make their way through it without picking up on things like uncertainty when answering or nervousness or crossed wires. Also, if you are prescribed something or booked in for a procedure and so on, you should at least understand the basics of why you need it, what it's for. If you go to the doctor not knowing what's wrong, and leave still not having a clue what it could be with a prescription or a referral, find another doctor who'll spend a few minutes actually informing you. Sometimes that might mean telling you they don't know what it is, but that's a lot better than you leaving thinking it must be totally fine, as the doctor didn't say anything other than come back in a few days if you aren't feeling better. Unfortunately, I don't think there's a simple way for people without a medical background to evaluate the competence of their doctor. We get credited with cures unrelated to treatment and blamed for misfortunes that could not have been reasonably avoided. Patient satisfaction has far more to do with a doctor's interpersonal skills than their clinical acumen. Patient satisfaction has far more to do with a doctor's interpersonal skills than their clinical acumen. My wife works for a surgeon's group and we've talked about how malpractice claims track with bedside manner, and not the skill of the clinician. As a dentist, I have seen patients freak out when you tell them their tooth can't be saved. In few cases, dentists are either lazy or want to make more money by extracting teeth and then replacing them. I work with a major top 5 hospital in the US right now. Apparently one of the major red flags for recruiters is if the doctor has changed hospitals many times in the past 5-10 years. This shouldn't be confused with training at different hospitals when looking up your doctor though. For example, seeing they did internship at X, residency at Y, and fellowship at Z all within the last 10 years. 1. When they ignore what you say or fail to take an accurate history. This is when misdiagnoses tend to occur. 2. When they are overtly prejudiced regarding race, gender or disability. This can impact badly on your treatment. Most people are talking about doctors' bedside manner, which is important for comfort but isn't a great metric for actual skill or medical knowledge. Here are things you should actually look for in a doctor. Do they teach? Teaching residents and/or med students means they are constantly forced to examine their practices and ensure they're using state-of-the-art techniques. Does their staff, receptionists, nurses, etc., seem to have their act together? These people are an important part of treatment and further reflect the capability and mental focus of the doctor. After hearing your symptoms, do 3 ask questions. If so, do they seem like weird, random questions? If you answered yes to both, that's a good sign. It means the doctor has come up with a mental list of possible diagnoses and is trying to narrow it down, as opposed to just immediately declaring it to be the most obvious. Bedside manner is an important aspect of treatment for the sake of comfort, and is the easiest criteria for patients to judge their doctors by, but there are a number of other factors that play in. Look at Dr. Townsend from season 2 of Scrubs. Super popular and friendly doctor who everyone loves, yet he gets fired. Why? Because he let himself fall behind and was, at the end of the day, a really crappy doctor. I think the biggest red flag is if your doctor acts like a dong to you. Doctors are people too, and they come in all varieties. If you meet a doctor and she is a jerk, never go back to them. There are plenty of doctors out there and you can find one with empathy who makes you feel heard and respected. Don't let them talk down to you. Your feelings and concerns are valid regardless of what anyone else tells you, and you deserve to find a doctor who is willing to be there for you. Ask for a second opinion, ask for a referral, or ask to be scheduled with a different doctor next time. If you feel like your needs were not addressed, ask for short follow-up, 1-2 weeks. If you go home and feel worse, call in, ask for help. They may send you to the for $1 million workup, but that may be what you need. Scans, stat lab work. Don't settle. You may be the patient, but you can still be in control. I can tell you the best way to find a good surgeon. Talk to the nurses and therapists who see their results. While they most likely won't tell you that a surgeon is bad, what you can do is call up your surgeon's office and ask them to give you the numbers of several physical occupational therapy clinics they refer to, if applicable. Then call the clinics and tell them you need post-op therapy with their clinic. Who would they recommend as a surgeon for their own mother? This will hopefully get their empathy engaged, and they will tell you which doctor is the best in their experience. Also, look online for reviews, and find out your doctor's license number, and research your state's public records to see if they have had any lawsuits filed against them. A few things that come to mind, based on knowing which of my colleagues is incompetent. 1. Prescribing you narcotics rather than exploring why you have pain. 2. Ordering imaging but not able to give you some idea of what they're looking for, even if it's just ruling out X or Y. 3. Ordering uncommon or expensive labs without being able to explain what a positive or negative result would change in their management. 4. Prescribing an expensive drug without being able to explain the benefits over an older or cheaper generic alternative. 5. Not performing even a focused physical examination. Doctor here. An incompetent doctor is generally hard to find. In general, you don't progress up the ranks if people know you are incompetent. You generally get drummed out. My consultant gave me some good advice. You will kill people as a doctor. The trick is to kill people on their way out already. What you should always practice is defensible medicine. You can do all of that and the patient will still die because you didn't notice something because you were distracted, sad or bored, or because there is always option 4. Patient is being a dang fool. Like my patient who I did everything for and who then proceeded to refuse to use the bedpan, go to the loo by himself and trip and fall and fracture his skull. He made it, but it probably didn't do wonders for his actual condition. The various incompetences are: 1. Lack of knowledge and experience. 2. Poor patient communication. 3. Overextension. 4. Stress. 5. Good old dumbassery. 6. Error. And you can be an incompetent doctor one day and be a perfect one the next. Like today, I kept sending out radiology requests without mentioning what views I wanted. Not a deadly form of incompetence, but just weird. The places where you kill are error, stress and overextension. Few doctors are mad enough to do procedures they know they cannot. But the biggest cause of incompetence is error. We all make mistakes. A competent doctor makes daft mistakes. An incompetent one makes deadly ones over and over. So let's take intubation. One of the major places where newbie doctors screw up is checking if the airway is in position. I would connect up the breathing and then use a steth to check if I can hear breath sounds in the lungs and stomach. If I can hear them in the lungs, yay. If I can hear them in the stomach, then boo. That's because I am competent. The new juniors are not, but that's okay, they are learning. The trick is to learn those things before you are responsible for them. And don't look at survival rates. Better doctors may have poorer survival rates. I mean, mine's close to 100%, but my mum's is more like 90% because I just made junior resident while she's a consultant. Her cases are more likely to die than mine. Also, dermatologists have low mortality rates, so a 99% rate in a dermatologist would be considered really bad, while a 90% rate in an oncologist would be really good. In fact, suspiciously good. It's like having a 100% ball to bat hit rate. I am British. We play cricket. In baseball, if someone said that, you know they are lying. Not explaining the diagnosis. Not giving alternative legitimate treatment options. Rarely is there ever only one good option from an actual licensed healthcare professional. Sure, but there's usually a best option or an ideal, and that's the one they want you to take. If you say no for whatever reason, then they bring out the laundry list of other subpar options. But they're not going to give you 5 choices when there is rarely a reason not to choose the first and best one. It's a waste of time and confusing for the patient. You're not in a restaurant. I have a rare medical disorder and happen to be in medical school. I have a team of doctors and it has taken me years to find doctors I can trust. The biggest red flag is when a doctor doesn't believe you. The only person who knows your body is you. If you think there is something wrong, there likely is. Find a doctor who will hear what you are saying and address your concerns, not dismiss them. Other red flags I've encountered are when doctors 1. Discriminate what treatment to give you based on how they feel you are as a person, i.e., whether to give you painkillers because they think you are a junkie, or not giving birth control because they think you are OS. 2. Make you cry. 3. Tell you that your symptoms are all in your head. This is very rarely the diagnosis. So rare, in fact, that a workup should be done. Then, if nothing shows up, this possibility should be explored gently, not crammed down your throat. 4. Treat their medical staff or students disrespectfully. A doctor like this is not on your side, I promise. A doctor who doesn't have any empathy for your situation and just wants to treat the medical bit and get rid of you. As a patient, you should not be treated like a case out of a textbook. A good doctor will ask you how you are coping at home, what your biggest concerns are, and they should try to put you in touch with OT social services, charities, advocacy groups to try and improve your quality of life as a whole. Someone who uses this kind of holistic approach is someone you want as a doctor. This is Pizza Cat. He looks for people like you to befriend and give them the gift of unlimited pizza. This can only be granted if you comment pizza please. Thanks for watching. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day, you magnificent people.